Hello everybody, my name is Ollie, welcome back to the channel. I am a junior doctor living and working in England. It's great to be back. I'm actually on my day off. At the moment I've started a brand new job. I've started my final job of FY1 or my foundation year 1, my first year of practice as a doctor after leaving medical school, and that final job is acute medicine. But that's not what this video is about. On the channel recently, I think, unfortunately, a lot of the videos that I've been making, just because of what's been topical and in the news and going on more widely, have had a slightly negative tinge to them. And perfectly reasonably, lots of medical students that I know watch this channel have been messaging me going, Ollie, is it all doom and gloom? Like, is the career still worth it? What are we doing? Are things just getting worse and worse and worse? And that's why today's video is going to be 5 things that I love about my job as a doctor, and 5 things that I think you will love too. But before we jump into those, please remember to hit the like button for me, subscribe to the channel, it really helps me out and helps me keep everything free for you guys. But let's start with number 1. And number 1 is getting to have meaningful interaction with patients as a scientist. As many of you know, when I finished my bachelor's degree, my undergraduate degree at Newcastle University, I was studying molecular biology. I was faced with the choice of having to pursue a more academic, scientific career by starting a PhD, or indeed to leave academia and instead go into medicine. Ultimately, I picked medicine because I wanted to work with people. I'd done a little bit of work experience, a summer internship, working in a lab and getting a feel for that, and ultimately just decided that it wasn't for me. And I really wanted to be able to use my scientific knowledge, my passion and interest in science, but to make a more tangible difference to people directly in front of me, rather than perhaps working in a lab and affecting a very large number of people with the discoveries and advances that I made, but I'd probably never get to meet those people and see the impact that I was having. I needed something that I was going to find a bit more personally gratifying. And the great news is that that was 100% the right call, because the training, the portfolio, the academics, all of that aside, the best part of my job is being able to speak to people and use my knowledge to help them and guide them through their journey as a patient. Unfortunately, I think that many patients are still very passive participants in healthcare, more like recipients of healthcare. And often I find that unless you specifically ask somebody if they understand what's going on or why we're doing a particular test, they often don't understand and they're just sort of going with the flow. But that's not good enough. On my last shift, for example, I had a patient who needed a blood transfusion. They'd been told that they needed one, but not why they needed a blood transfusion or what the blood transfusion was actually going to do, or the risks and benefits of having a blood transfusion, which is something that we absolutely should be doing. And in medical environments, especially in emergencies and more acute situations, these more communication elements do get pushed to the side a little bit because people are panicked and trying to deliver care. But we do need to be mindful that patients are agents themselves and they are the decision makers. We need to be guiding them through it. And I love being able to go up to a patient and say, "Hi, I'm Ollie, one of the doctors working on the ward. How can I help? Do you have any questions about anything?" And I don't always know the answer, you know, I'm recently qualified, but always I will make sure that if I don't know the answer, that they will speak to somebody who does know the answer. I think ultimately it's the challenge of trying to explain these very intricate and very scientific and very detailed workups and procedures that we are doing for patients, to be able to explain these very complicated things in such a way that the average patient can understand what we're doing and why, and enable them to ask questions and participate in their care. I think that is my favourite part of my job. Number 2 is that there is always something to learn. I think this is one of the very great things about a medical career, which is that there will always be something that you can learn, because it's such a vast, all-encompassing field. And we often discuss medicine as a career of lifelong learning, not just because you can choose to continue learning, but because you have to. Medicine is rapidly changing all the time, and as you train in your specialty and become a specialist, or indeed remain a generalist, there is new clinical evidence coming out all the time, new massive randomized controlled trials, even qualitative studies that guide us on how patients feel about particular interventions. You have to stay up to date with all of this stuff. And this actually happened multiple times while I was at medical school. I remember in my second year, I think it was, the treatment guidelines for pulmonary embolism changed, the NICE guidelines changed, and the first-line drugs that we used changed even while I was at medical school. So now that I'm a practicing doctor, I am using the new regime, even though what I learned in medical school was already out of date. And what's specifically nice about this element of lifelong learning is that there will always be something that you can practically apply to change your practice. It's not simply a case of remaining kind of up to date and interested and reading things that sort of exist in the abstract and aren't necessarily applicable to your practice. You can read something literally on any given day and it will change how you practice and go and interact with patients that day. And if you keep doing this and keep learning, even one new thing every day, you can imagine how quickly you become a much more competent physician than you otherwise would be. Third thing that I love about my job as a doctor is the problem solving and detective work. We often describe medicine in this way as detective work, and if you think about the skills that are selected for before someone goes to medical school, your verbal reasoning, your communication skills, your problem solving, your abstract thinking skills, these things are actually incredibly important for the job, because every single case is one that we will have to work up, as the term is. Understanding why this patient has presented like they have. What led to the problems appearing at all? Can we prevent them from appearing next time? What are we actually going to do to solve the problem? What barriers exist that might stop us from solving that problem? And how are we going to pick a treatment option that suits the patient in front of us? And although many parts of medicine are what we call algorithmic, that is, if A then B, if not A then C, and simple sort of flowchart decision-making diagrams, the thing that makes the training of doctors unique in the health professions is that we are trained not simply to follow algorithms, but to know when to break the algorithms when they don't match the situation that's in front of us, because we have the basic sciences understanding built from the very bottom up to enable us to solve problems at all levels, essentially from the microanatomy down to the gross level when the patient presents in front of us. We are clinician scientists. We have the tools to solve problems when our traditional problem-solving tools, which are decision-making algorithms, when they don't work, we still have the knowledge and understanding to solve the problems, or indeed make the best attempt we can at solving the problem in front of us. And again, this is what makes your very experienced senior doctors and consultants not simply able to deal with the common and curable, but because of that multifaceted, multi-layered approach to understanding and solving problems, they can recognize not only the common and curable, but the very rare unicorn and zebra conditions. When they present, the very rare and unpredictable, they can spot them, and even if we have no idea what is specifically going on with a patient, we can put together an action plan because of the ground-up approach to problem solving. It really is detective work. Number 4 is colleagues, specifically the range of very passionate and very qualified colleagues that you get to work with when you're working as a doctor in the NHS. Now, I do have to put my hands up and say that the NHS multidisciplinary team is a very complex beast. It's very political, very hierarchical, and that itself often generates a huge number of problems. Simply by being what it is, everyone is passionate about their own corner of care, and that's very understandable. It does generate problems. But in exchange for dealing with that and tolerating that and trying to fix those problems that arise, what you get is a slew of incredibly qualified, incredibly passionate, very, very engaged group of people. I think doctors and nurses, understandably, often get a lot of the spotlight when it comes to thinking about hospital care and care in general. If you asked people to name healthcare professionals, I think most people would say doctors and nurses first. But it takes a ridiculous number of different professions to make the healthcare system work. Think about paramedics, lab scientists, dietitians, speech and language therapists, psychologists, psychotherapists, cleaners, physiotherapists, occupational therapists, operating department practitioners, surgical care practitioners, PAs. There are too many to try and name, but we're all training in our own thing and trying to do the best we can for patients. And then learning comes from the fact that everyone is training and qualified and passionate about their own thing. I'm a doctor, right? A physician. I'm trained as a physician, and I solve problems and do things in the way that a physician is trained to solve them. And the same is true of all of the allied health professions. Whenever I get the time, which admittedly unfortunately isn't very often, if I get the chance to see another health professional doing the thing it is that they do, I will take the time to stand there and watch. For example, if I want to see a physiotherapy assessment, or I want to see a cardiac stress assessment, or a swallow assessment, or a discussion with a dietitian, all of these things are useful to me because as a doctor, one of my most important roles is explaining to patients why we are doing particular investigations and particular tests, what we're looking for, and fundamentally what these things are going to involve. If somebody needs a chest x-ray, for example, I should be able to explain to them roughly what that's going to involve. So if my patient goes for a chest x-ray, I will go and watch the radiographers take that x-ray. If it's a position that I've not seen before, I'll go and watch that, because I need to be able to communicate this to my patients when I'm explaining their care plan. And then number 5, finally, to bring this to a close, is that as doctors we have so many options. One of the things that makes me the most excited about the medical career, and why you should be excited about a career as a physician, is that we have so many options available to us. Because although we are unfortunately hitting a period where vertical progression up the career ladder through as a specialty trainee and towards a consultant, that is becoming harder and harder. Training numbers are getting harder and harder to get, it's taking more years to get them, and there are no more consultant jobs for the increasing number of medical students coming up. So vertical ascension getting harder. However, because of this, there is an enormous degree of lateral progression and lateral movement. What do I mean by that? What I mean is that you can work beyond your core clinical role as a doctor. Our roles are pretty well defined, but you could also work as a leader, as an educator, as a research scholar, as an entrepreneur doing something on the side, as a quality improvement fellow. Portfolio careers are becoming more and more popular as people realise that they want more to their lives than simply being a clinician seeing patients, and less than full-time training is becoming more and more accessible to many different types of doctor. And I think people are realising that they can get so much more satisfaction and meaning from what they're doing by doing all of these extra things on top of their core role as a doctor. So I, for example, as a newly qualified junior doctor, have what's called an academic foundation job, and that not only means that I'm able to go through my training and develop as a young doctor and build all the clinical skills and clinical knowledge that I need to do that, but I also have protected time for doing research in the areas of interest that I choose, which are medical education and neurosurgery, as well as having that time to develop myself as an academic more widely. But I also have protected time for teaching medical students as well, which is the other thing that I love to do. And I think there are very few careers and professions where we have that degree of granular control over these elements of our job. It's like the best thing in the world that I'm able to say, in this 4 months during this academic post, I want to do a bit of research, I want to do a bit of teaching, and I want to make sure I'm developing my skills as an academic. And they were like, yep, cool, do that. You've designed your own job plan, let's do that, we'll pay you, you sort out what you're doing. And you get rewarded for all of this stuff. People realise that it's important, and you get taken seriously because you're a doctor, because you're a physician. That carries weight, and it allows you to forge your career in the direction you want to. Now, increasingly that unfortunately may be less via the traditional training pathways, because the government have made it very clear that they're not bothered about training enough doctors to meet demand. But as far as I'm concerned, that simply means that we have to forge our careers in other directions and take control of what we can. And I think the way that I want to close this video, guys, is by saying that my job is amazing. I love it to pieces. It's the best job in the world. And I'm obviously saying that as a very newly qualified doctor with not much life experience under my belt. Now, the stuff that exists around it, the bureaucracy, the hierarchy, the NHS, the difficulties of the MDT, all the rest of that stuff, very annoying, very difficult, very frustrating, but my job as a doctor is the best job in the world. And if you're convinced that it's the right thing for you, then it is the right thing for you. And I encourage people, despite everything, if what you want to be is a doctor, then there is no other job that is as good. I love my job. It's the best job in the world. And you guys that are still going through medical school and a bit worried about the doom and gloom, don't be worried. You may have to be a bit more proactive than people were before, but it is still the best job in the world. So thanks very much for watching, guys. Take care, and I'll see you next time.